Hello, my name is Lauren Valenzuela, and in this presentation I will be discussing the premises of the documentary The Medicated Child, which discusses the early intervention of prescribing medication such as antipsychotics, antidepressants to pediatric cases diagnosed with bipolar disorder. As an early diagnosis, children are commonly diagnosed with ADHD or either bipolar disorder. The criteria between the two, according to the DSM, are similar. The only thing that is different is that the DSM does not specify the younger population of a bipolar diagnosis, which would in some cases be difficult to diagnose children with either symptoms, prescribing the right medication. As to when it comes to the prescribing the right medication and misdiagnosis, ADHD begins in childhood with excessive motor activity and associated with reduced school performance. Associating with bipolar disorder, children with ADHD may show significant changes within mood in the same day, such as a liability, distinctly from a manic episode as described as a bipolar disorder. Bipolar disorder is preceded by and may be followed by hypomanic or major depressive episodes exceeding 4 days when it comes to diagnosing a child with either disorder. When it comes to the diagnosis, it needs to be prescribing the right medication within the premises of the diagnosis to be able to reduce the symptoms that are so stressful towards the children, as well as certain medications that would be provided due to the availability based on the vast number of medications in the world that would be helpful towards either diagnosis. But when it comes to the combination of medications for common symptoms within each disorder of ADHD and bipolar, side effects are described thoroughly within the documentary from multiple medications that could reside in obesity based on the neurological function of always being in the state of hunger, and overstimulation in the brain from the multiple medications that could increase side effects or tics of physical stimulatory behavior. As against the use of mood stabilizers, antipsychotics in treating pediatric cases of bipolar, the documentary of The Medicated Child mentions the FDA looking over data on the use of antidepressants that would be used for children diagnosed with bipolar disorder, and that a few studies were positive effects towards children. On the other hand, children were truly diagnosed with ADHD, depression, or anxiety and are being treated with common bipolar drugs that may experience their adverse effects and not progress, which it depicts the combination of range of medications. As some medications such as lithium are neuroprotective, when it comes to other medications provided, it can lead to serious suicide. And as to little research being done within the premises of the pediatric cases within bipolar disorder as well.